Hey there, if you are suffering with cubital tunnel and you want to know, what do I do? Can I fix this myself? My name is Huang Tran, and I'm going to share with you some exercises and some movements that can help you with treating cubital tunnel on your own. Now, do I recommend it? Sure. If you have it very mildly, meaning that you have a little numbness, and tingling here and there, but it's not all the time, then definitely try some of these yourself. I will say that if you're trying some of these things, but they're not necessarily helpful or they're not helpful for a long period of time, then I would recommend you find a certified hand therapist, a local hand therapist in your area that can help you determine like where is this cubital tunnel coming from? Like why does it keep happening? Right? So here are some stretches that I'm going to recommend. Oh, actually, before recommending the stretches, one of the key things to treating it yourself is actually modifications of what you're doing. So check this first. If you bend your elbow and hold it for 60 seconds, look at the clock, look at the 60 seconds. If your fingers go numb for sure here, then you most likely have cubital tunnel. And because when you bend your elbow, it compresses that nerve the most. One thing that you can do is stop bending your elbow all the time, which is it's terrible advice. Like stop bending your elbow. You're always going to end up bending your elbow. But one thing that you can do at night to relieve some of the symptoms of compression during the day and at night is to I get a big bath towel, fold it in half the long way, and then wrap your elbow around it. So when you're sleeping with something like that, it's going to stop you from bending your elbow all the way. And it's a great way to get started to relieve some of that compression and that tension that you're putting on to that nerve at night. So try that out. You have to wear that towel around your arm for every night for a good month. And then after that, you should be able to see like, oh, is it getting better? Because it's one of the things that you're going to do. Right. The other thing that as hand therapists, like back like over 20 years ago, we used to recommend was getting a splint. But those are so much harder to wear at night because it's gosh, it's hard, it's fitted, and it's long, and it stops you from bending your elbow. But a towel works the same. If you feel that you are resting, so that nerve gets exposed right here is your funny bone. It's very, very on the surface, superficial. If you put your finger right in between these two bony prominences, you're going to feel that ulnar nerve. If you tap on it and it sends a tingling down to your fingers, that's your nerve. I can tap on mine and it doesn't have an issue, but if you tap on yours lightly and you feel it, it's a little irritated. You can wear what's called like an elbow sleeve, and you just put a little cushion there so that if you're typing on the computer and your arm is resting on the table right there and it gets irritated, you can do that as well. So those are two essentially modifications that you can take to treat yourself and reduce some of the symptoms that you feel. But some of the exercises that you can do are completely different. And one thing that I always want to preface when I'm working with someone with nerve issues, our nerves are really sensitive, right? Nerves are really sensitive. If you can think in your friend group, you got that one friend that you can't really say stuff to, they're kind of sensitive with everything. Their feelings get hurt really easily. You sort of have to, say things to them real nice, be gentle because that's just how they are, right? And you love and accept them, but they're sensitive, so well, nerves essentially are the same way. So nerves, compared to like how our joints are, how our muscles are, nerves are just a little bit on the sensitive side. So you might see videos where they're like, stretch the nerve, do this. Nerves are really sensitive, so you want to pay attention to how your nerves react to stretches, right? You want to pay attention to how nerves react to the stretches. And though your nerves, though it might feel really good in the moment of stretching. Nerves, a true nerve issue might have problems later that night or the next day. And so a lot of times people, they'll do their stretches and they're like, but I do all this stretching. I'm like, sometimes you're just a little too aggressive because you're stretching a nerve the way you would stretch a muscle, and they're not the same. So you want to pay attention to how aggressive you are to stretching the nerves, because it does not feel the same. All right. So one nerve stretch for the ulnar nerve is it looks like this. So this is how I teach it, right? There's a lot of different ways to do it, but this is how I teach it so my patients, my clients remember how to do it. So you want to put your hand up to your ear, kind of like you're holding a phone, right? Kind of like you're holding a phone. You're going to flip it upside down, then turn it back up, and then you're going to pass it out. Ooh, right? And you see how my fingers stay open, my wrists stay back, and my elbows go straight, right? And I'm going to keep my neck looking forward. So like you're on the phone, you're going to turn it upside down. You're going to flip it back up like you're on the phone, and then you're going to extend out your elbow with your wrist as far back as possible. Try it on both sides, and you're going to see the difference. When you have nerve tension, you'll feel this deep achiness on the inside. You can't pinpoint it. It's not like a muscle pain. It's not like a tendonitis. It's not like your bone is broken. So a lot of times people associate certain sensations with other things that have happened, but nerves don't feel the same, right? Nerves, they're their own person, and you can't compare them to everyone else. Check your other side and see which one has more tension, right? See which one has more tension. And it feels really deep and achy, kind of like a bad toothache, and you can't pinpoint it. You're like, where is it? I just feel it all over, right? If you feel very tense, I mean, I've worked with people who cannot straighten their elbow. They have so much nerve tension. I have worked with people who can extend their elbow, but their wrists and their fingers cannot go into extension, right? So that's nerve tension. When it's so tight, it doesn't glide. Nerves like to glide. They're not like muscles and tendons. Muscles get long and get short. They get long and they get short. Nerves like to glide, right? So if you think about that, that is one particular nerve glide that I personally like to do with my patients. And it's a more advanced move, right? So you can take it real small. You can take it real small. If you can't go all the way through, just do half of the motion, right? But you don't want to be too aggressive because it's going to get irritated. And you actually you have to learn to, listen and trust your body. If it's too much, right? It almost has that sensation of like, oh, but if I do it real hard, it's going to feel really good. It's going to scream at you later. She's going to be crying, okay? So don't do it. You know your friend's sensitive, so take it easy on her. She might need a little bit more time, and that's okay, right? And that's okay. So just go real gentle. And this is a nerve glide, so you don't have to do like 10 repetitions. You do like 2 or 3 good ones, come back later and check on her, be like, oh, can I do a few more? Check on her a little bit later, see if I can do a little bit more. But nerves, if you overdo it, they will scream at you later. They never scream at you at that moment. They're going to scream at you later, and you won't be able to sleep. Your symptoms will feel worse, right? So, check on it. Go gentle, go slow. So that's so I gave you 2 modifications you can do. I gave you an ulnar stretch. And another thing that nerves like to do, the nerve passes right here. So sometimes it's because the muscles are really tight. And so one way to work it is to work out the tension that you have. Again, don't be aggressive. right? Don't be aggressive. She don't like it when you're aggressive. So one thing that you could do is you can put your hand on top of your head and you can work the tricep. So here's your tricep. Let me turn this way. Here's your tricep. The tricep is huge. It's a huge muscle, right? And it comes down around this area. And of course, the muscles that move your fingers and your wrists also come and start right here at your elbow. So you can put a little bit of cream or without any cream. It doesn't really matter. You can massage. You can massage the muscles in that area, right? You can twist it around, you can massage the muscles. If your arm's really tired from putting it up there, you can do it, and you can do it right here, like really here on the side. But I recommend, I don't know if you can see it, but you can, let me tilt my camera down, and you can rest your arm on the table, and you can do it this way as well. All right. But those are some things that you can do just to alleviate the symptoms, right? Just to treat it yourself. The key thing about treating it yourself is if you've tried those things and after a month they don't work, or it doesn't really fully go away, like it goes away, but it comes back and it goes away and comes back, then you might not be getting to the root cause. And it might be worth it for you to find a certified hand therapist or a hand therapist in your local area, like an occupational therapist who can help you figure out, well, what's really causing the issues. The ulnar nerve comes from your neck down your shoulder and down your elbow. So if you think you have cubital tunnel, you might have it, but there might be some other issues that are causing it, and it's important to really get to the root cause and find out like what's actually going on, so you can fix it, and fix it correctly, so that you, one, don't have the numbness and tingling, but two, remember, nerves are like the electricity system of your body. So when that nerve gets compressed and compressed over a long period of time, it can essentially kill parts of that nerve, and you don't want to do that, because nerves give power to the muscles in your hand and your arm, and over a period of time, you can lose that strength, and you can lose that strength forever. So if you try it out for a month and it doesn't work, then go find a therapist so they can help you really figure out where the root cause of your problem is, right? So 2 modifications, an exercise that you can modify, a manual treatment technique to help you alleviate some of the muscles around it. And one other thing that you can do in terms of treatment for yourself, people ask me this all the time: should I use ice or should I use cold? And in terms of nerve issues, if you truly have a nerve issue, nerves respond better to heat than it does to cold. So especially if the cubital tunnel right here is more exposed than most nerves, and when you ice it, it can get a little bit more irritated. So try using a little bit of heat there versus ice, and then give yourself a chance and see if that actually helps you. All right. If it doesn't help you, then it's beyond treating it yourself, and it might be worth it for you to seek out some professional help so you can get rid of it for good. All right. My name is Huang Tran. Thank you so much for watching. I hope this really helps you, give you a little bit insight into treating cubital tunnel for yourself. And if this hasn't really worked, or you really want to get some guidance in terms of what you can do to get rid of cubital tunnel faster, then you can find me here at Hands-On Therapy Services. We have a clinic located in Miami, Florida. So give us a call. All right. If you like videos like this, please let me know. Leave a comment below, and hit subscribe, share with a friend, and I'll see you on the next video. Thanks for tuning in.